Welcome. I'm Morley Safer. Society must cope with such devastating ailments as cancer and heart disease. Research has provided us with some important tools to help eliminate many diseases. But we still rely on a number of organizations to provide support services. Our next story offers an example.
We often see a doctor when suffering from aches and pains, or even symptoms of the common cold. And with each visit there is a charge, even with health insurance. But with costs on the rise and an aging workforce, how can employers make sure they're helping their employees get the most value for their dollar?
This year, that same carrier just yesterday announced an increase of 34% in our health insurance. When you talk about roughly an $18 million budget, which we're having difficulty meeting already, that means a $6 million increase in the next year.
Many companies are now turning to outside sources for help in obtaining higher value-based healthcare solutions. For some, the cure is starting with employer coalitions.
We're a very large constituency of people that purchase health care, and so I think working together makes us a little stronger, and indeed we do want to be able to make some changes in the way health care is delivered in our community.
Because healthcare is a major expenditure for corporations, many choose their insurance coverage based mainly on its cost.
You want to get the best bargain you can, but you also want to maintain some satisfaction with your employees over what their plan is and the value that it has.
Today, many employers measure productivity losses only in terms of absenteeism, while conditions such as asthma, allergies, and depression often keep people home from their jobs. Employers are learning these afflictions also keep them from properly functioning while at work.
We've been able, through the data, to look at the lost productivity while at the job. We also call it presenteeism. Allergy, the average days lost out of every 20 work days that was reported to us by employees was 3.2 days are being lost out of every 20 work days, with only 1/10 of the 3.2 being absenteeism. As a result, we as employers are paying for the employee's time. We're also helping to pay, along with the employee, for the medications and the services and the medical interventions that are being used. So we have a great desire to want to look at those interventions that would impair the employee the least.
An example of a medical intervention to improve productivity while at work is the use of non-sedative versus sedative medications. Coalition members such as Verizon are finding that the survey results are providing a better picture for viewing the value of their health care costs.
The potential savings per 1,000 employees in regards to impairment in productivity is $7 million. That's an awful lot of money, money that we can funnel into a different area in regards to outcomes and productivity and quality. And that's what we're looking for, to be able to utilize our dollars in a more value-based manner.
But value to us is the real issue, and that is not just what we're paying, but does the medical intervention we're paying for get the best rate of return on invested dollar in terms of keeping the employee's health and productivity at peak performance. And they are human capital, and that's the way we view it. We take care of a lot of equipment, spend a lot of money on equipment, but we don't always maintain and spend the kind of money on the human capital, which is by far the most valuable capital that any company has. And we're looking at that. We're in the process now of working on what we call the rate of return on invested dollar project, the ROI project. And we're actually going in and looking at the cost of the medical intervention and dividing it into the potential savings from productivity loss at the job. And right now, some of them are coming back in the neighborhood of 3 to 10 times more savings on the job than the total cost of medical care. So it has become a real issue to the CFOs and other financial officers and CEOs around the country. And there are a lot more employers now looking to want to participate.
As projects like this continue to unfold, there is hope that the results will help provide new information to promote a healthier community and more productive workforce, giving employers a hidden competitive edge. Wherever the art of medicine is loved, there also is love of humanity. Once again, American Medical Review extends a special thanks to the companies and organizations that have risen to meet today's health and wellness challenges.